I'm going to go into advanced pharmacology. Pharmacology is the same any day, anytime, from anywhere, any source, wherever you get it from. But before we even go into that, where does it even fall under? It is mostly under implementation. Let's not forget the ADPI process. That is the assessment, the diagnosis, the planning, the implementation, and the evaluation. Now, what is the difference first between AANP and ANCC? AANP, don't forget, is short and sweet. It's just straight up knowledge. ANCC is knowledge now plus what? Plus critical thinking. That is the big difference. That's what makes ANCC a little bit unique. We're now going to talk about pharmacokinetics and pharmacodynamics. Before we got here, where did all this come from? It comes from pharmacology. Pharmaco means drug, and then ology is the study of drugs, right? Or what the body does to the drugs. So now we're not going to look into each concept underneath it. It is the pharmacokinetics. Pharmaco is drugs, kinesis is movement. How do we get things from point A to point B, C, and D, right? So what are the processes under pharmacokinetics? It is what? It is the process that undergo what? Biochemical processes that result in absorption, the distribution, the metabolism, and the excretion. So to absorb is to take it in, and now your body is absorbing it. To distribute is to spread through your body. To metabolize is to break it down. To excrete is to come down from the other end. That is all it means. So why is this important? It is important because every medication that we give to our patients that goes into their body goes through this process. So when we say absorption, what are the things that can go wrong with absorption? That will now be the focus for our exam, especially the advanced nurse practitioner examination. Because now you are providers, it is your responsibility because you're giving that medication. Listen, the absorption, what can go wrong? Things can go wrong on the road as we are moving from A to E, right? The absorption to the distribution to the metabolism to the excretion phase, things can potentially go wrong. Similarly, when we drive a car, things can go wrong, God forbid, but things can go wrong on the road too when people have a car accident. So now, the road, we're going to pretend it is the GI mucosa, it is the GI tract. So now absorption may be altered if something goes wrong with the GI system, period. So what other factors must we put into consideration? Stability and solubility of medication, the GI pH and emptying time, the presence of food in the stomach. Why do you think they make your patient poop all the time? Because that food is going to be in the way and the med will not get through or get absorbed properly, so it's not going to work. It's not going to be efficacious. Speaking here is Dr. Kehinde ELISHA, founder of FNP Certification Academy. To reach us, nursetonursecoach@gmail.com. Visit www.npcertificationacademy.com. Now, some other current medication may also affect absorption. That is the drug-drug interactions. Forms of medication is the enteric coated. It's also going to affect absorption. So absorption takes place, if you think about it, from the mouth down there. So it goes all the way down there. So now, which other means do we give meds? We do sublingual, we do buccal. So what are the barriers that we may encounter while administering these meds? Swallowing before dissolution allows gastric pH to inactivate the medication. Absorption pattern. Quick absorption systemically through highly vascular mucous membranes. Other mucous membranes like rectal and so on. These all affect the absorption. So the route at which we prescribe or administer this meds is extremely important. What are the barriers to absorption? The presence of stool in the rectum, of course, it's a problem. Or infectious material in the vagina that limits the tissue contact. Anything that affects the drug to hit or to touch where it's supposed to go to, it's going to affect the absorption. It is a barrier. Now, so we're now going to quickly talk about other types of barrier here. So let's talk about like for example, intradermal. Okay, they may have slow or gradual absorption. Affect primarily local or systemic as well. And of course, especially with lipid-soluble medications passing through the sub-Q tissue, of course, or sub-Q intramuscular, there are also barriers there. So the barrier is like the enemy that affects the absorption. So if our meds is affected, if the absorption is affected, the medication will not work. So absorption is extremely important to pay attention to. We also have IV. We know that one gets an immediate absorption. So we have to be careful and be ready for an effect when we inject something into somebody's bloodstream. The next phase of pharmacokinetics is the distribution. We have four phases of what? Pharmacokinetics. It is the absorption, it's the distribution, it is the metabolism, and of course the excretion. As we are now distributing the med that we took in under pharmacokinetics, something may also be wrong with our circulatory system, like we may have blood pressure issues, we may have perfusion issues, you know what I mean? We may have PVD. This is going to affect the distribution. The drug is not going to circulate like it should. Does that make sense? Now, permeability of the cell membrane. Now, medication must be able to pass through tissues and membranes to reach its target area. Medications that are lipid soluble or have a transport system can cross blood-brain barrier and the placenta. So now, another issue that can also affect the distribution is the plasma protein binding. We have too much protein, of course, it's gonna bind to a lot of the drugs. We have too little protein, we're gonna have the many unbound drugs in the body. Can you visualize? So, see a protein as a glue. When the drug lays on it, it's gonna attach to it. We don't have enough glue. We don't have enough protein in the body, for example. There is nothing to glue onto. So the drug will remain inside the body, causing toxicity. This is particularly important in our geriatrics. Understanding the foundation is what's going to get you through pharmacology. Stop dreading pharmacology. Pharmacology is like any other subject, but you must get the foundation right. When we don't build the foundation of the house correctly, guess what? The house is going to get to the top and crash, and you're going to continue to rebuild, and you won't get anywhere. That is exactly what goes on with us. But now you're getting the foundation. The next process, which is the third process, is the metabolism. Metabolism is what? Biotransformation changes medication into what? Less active or inactive forms by the action of enzymes. This occurs mainly in the liver, but it also takes place in the kidneys, lungs, and tissues in the blood. So metabolism, simply to put, it's a breakdown. How does it happen now? It happens in the liver. In that liver, there is a truck in there. That truck is called what? The cytochrome P450 enzyme system. Now, when it crashes, it's going to produce two things. It's going to produce the inducer or inhibitor. Induce is to reduce. It's going to diminish the efficacy of the drug inside the body. Inhibitor is what? I problem. That one will shoot the level of drugs to a toxic level. So what are the factors affecting the rate of metabolism? It is the age. It is increase in some medication metabolizing enzymes. It is the first pass effect that will be on your test, period. FNP, AGNP, watch out for that concept. Similar metabolic pathways and also can have some kind of influence. But let's take age for a start. So infants have limited medication metabolizing capacity, same as our aging parents. They don't metabolize drug very, very well, right? But it varies with the individual. In general, the hepatic medication metabolism tends to decline with age. Older adults require smaller doses of medications due to what? The possibility of accumulation in the body. So increase in some medication metabolizing enzymes is also a factor. So this can metabolize, a particular medication sooner, requiring an increase in dosage. That would be like when we have an inducer drug, we have to go up on the drug. You will get questions on those like that on your exam. Induce and reduce. What are you going to do with your drug? How do you adjust your dosage? The only way to know how to adjust your dosage also what depends on the metabolic processes. You must understand this concept to know what to do. It is not something you can memorize. 3 or 4 day review is a joke. FNP, AGAP exam, AGACNP, these are big exams. You must understand from the root to the top. We recommend minimum of 8 weeks review. That's what we do, and that's what we do best. Minimum of 8 weeks. After 8 weeks, you don't get it, you're going to sit down in class again and until you get it. That's just the way it is. Unfortunately, many people are coming in with not enough knowledge, so we try to guide you right. I am not going to host a 3 or 4 day review because I know it's a joke. So increase in some medication, right, can also cause increase in metabolism over the concurrent use of medications. Now, the first pass effect, the liver will inactivate some medications if you give them through the wrong route on their very first pass through the liver. And thus, they require non-entry route. For example, sublingual or IV. Some medication like insulin too, why are we not swallowing insulin? Insulin like why are we giving the shot? The shot one, why are we not drinking it? Because it's not going to work, right? We don't want it to go through the first pass effect. That is why. Okay. Now, nutritional status. What kind of drugs, what kind of food are we eating? How is that food affecting the metabolism of our drugs? That also plays a role. Now, outcomes of metabolism. It can increase renal excretion of medication, inactivate inactivation of medications, increase therapeutic effect, activation of pro-medications called the prodrugs into active forms, decrease toxicity with active forms when active forms of medications become inactive, increase toxicity when inactive forms of medication becomes active forms. The last phase of pharmacokinetics is the excretion phase. So the excretion is the elimination of medications from the body. It came in through the mouth, it's going to come out through the other end, period. So kidney dysfunction can lead to what? An increase in duration and intensity of a medication response. So it is important to monitor BUN and creatinine. This is just the pharmacokinetics. We also have pharmacodynamics and pharmacogenomics to discuss. At the end of all that, we're going to talk about some basic meds. We're going to go deeper on inducers and inhibitors. And then we're going to do 450 questions in pharmacology. Minimum. We're going to get through 300 minimum, just in pharmacology. And then you're going to be able to expand your scope that way, and then you're going to pass your tests. So do you want to connect with us? Visit us, www.npcertificationacademy.com. Find us on our social media profile, through our social media. The profiles are right here. TikTok is right here, PMHNP exam review, or FNP AGNP exam review. YouTube, NP Certification Academy. Facebook, we have Nursetonursecoach. We have Instagram handle here too. So we look forward to having you. And most importantly, our website is www.npcertificationacademy.com. Or www.confidentprescriber.com. You can also email nursetonursecoach@gmail.com. Have a wonderful day. Dr. Kehinde, ELISHA speaking here. Thank you.